Welcome back to my channel. Today we are going to discuss about fetal overweight or fetal macrosomia. That's babies that have excessive birth weight ranging from 4 kilogram to 4.5 kilogram. And those that have countries that use a metric unit and in countries that use imperial units, it's about 13 pounds, 15 ounces or 9 pounds, 13 ounces, regardless of the gestational age. Why I want to talk about this topic is that in African setting, our people of African descent are usually worried about the birth weight of their baby whenever they come for antenatal clinics, knowing the complications that are associated with delivery of such babies of heavier weight. Now, I will give just overview of the causes and the risk factors associated with linking it to excessive fetal weight. One is maternal diabetes mellitus. There are some women that develop diabetes mellitus during pregnancy, that's gestational diabetes, or women who have pre-existing diabetic mellitus. This also is linked to delivery of larger size babies because of that the situation provides more glucose exposure to the fetus and thereby contributing to the overgrowth. We have excessive weight gain of the mother during pregnancy. Certain gaining more weight than recommended during pregnancy is associated with risk factor for having heavier babies. Then post-term pregnancy, that's where those whose pregnancy has exceeded more than 40 weeks. That is, it provides more time for that baby to gain more weight, and therefore resulting in babies of heavier weight, birth weight. Then history of macrosomic baby. There are some women that have previous history of having delivered babies that are overweight or macrosomic. There is increased recurrence rate for such delivery of such bigger babies in their current pregnancy. And delivery of male fetus. Male fetus are known to have larger birth weight than female fetus. Another factor is genetics and ethnicity. Family history of large babies or certain ethnic backgrounds can influence the birth of babies of larger weights. Then mother's birth weights. If the birth weight of the mother is within the macrosomic range for a fetus, the mother is a likely candidate to have babies that are macrosomic. This become greater or higher risk if such women marry large size man or married in a family that are also large size. The tendency that babies they will have in this within the macrosomic range, as I've stated earlier. Then certain ethnic groups are known to have large babies, like Pacific Islanders, Puma Indians, Native Americans of Arizona and Mexico, USA. Those people that have genetically, fat people, they are likely to have large babies of large size. However, Africans generally tend to have larger size babies, followed by the Caucasians, and finally by the Asians. Then multiparity. Women who have had multiple pregnancies have increased tendency to have babies that have larger weights. Then advanced maternal age. Older mothers, especially those who are more than 35 years old, have higher risk to have babies that are larger birth weights. So with this, I come to the conclusion of the causes and risk factors for having fetal macrosomia. Thank you for watching. Please subscribe and like. Stay safe and healthy.